Let us go to visual diagnosis of head hair. The topic is alopecia. The term falling out refers to a gradual loss of hair or to its slow growth or to excessively thin hair. Three processes are the main causes of unexpected hair loss. Insufficiency of blood leads to failure to nourish the superficies so that the hair cannot be maintained. If there is severe emotional distress, stagnation of liver qi, excessive fatigue, excessive stress on the heart and the spleen, or qi stagnation with blood stasis, qi and blood cannot rise and nourish hair. Insufficiency of the liver and the kidney leads to deficiency of essence and blood, so that the hair loses its nourishment and falls out. Hair loss in alopecia is unexpected and is usually noted incidentally. In most cases, it is confined to the scalp in a well-circumscribed round or oval patch about the size of a coin. Within the patch, the scalp is bald and shiny. There is no associated symptom. This is alopecia areata. Sometimes alopecia is disseminated so that there are several patches. In severe cases, the entire scalp may become bald. This is alopecia totalis. In a few cases, hair loss extends to the entire body surface, including the eyebrows and armpits. This is alopecia universalis. Alopecia is a chronic condition and may occur at any age. Sometimes it resolves spontaneously, but sometimes patients may have relapses. Here is a picture of two people who have alopecia universalis, meaning no hair on the top of the head and also their eyebrows. Alopecia may be due to several factors. First, blood heat, usually deriving from liver fire, which dries out the hair follicles, or internal wind rising to the head, or blood stasis, when the stagnant blood in the head prevents new blood from nourishing the hair. So alopecia due to blood heat is hair falling out in clumps, dry hair, feeling of heat, thirst, red tongue with rapid pulse. If it is due to internal wind, there's hair falling out in clumps with giddiness and wiry pulse. For blood stasis, there will be hair falling out in clumps with dark complexion and a purple tongue. For empty liver wind from blood deficiency, there will be sudden loss of hair in clumps with slight tremor of the head and or hand. There's facial tics, dizziness, blurred vision, unilateral numbness and or tingling of the limbs, pale and thin tongue with choppy or fine and slightly wiry pulse. The acupuncture points to be used are liver 3, gallbladder 20, DO 16, DO 19, liver 8, stomach 36, spleen 6, and REN 4. For full liver wind, there will be sudden loss of hair in clumps, tremors, severe dizziness, tinnitus, headache, numbness of limbs, tics, stiff deviated or moving tongue, and a wiry pulse. The acupuncture points to be used for this is liver 3, gallbladder 20, DO 16, small intestine 3, and bladder 62, and DO 19. For blood heat from liver fire, there will be hair falling out in clumps, dry hair, headache, red face, dizziness, tinnitus, irritability, propensity to outbursts of anger, thirst, bitter taste, constipation, dark urine, with red tongue with redder sides and dry yellow coating, and the pulse will be wiry and rapid. For liver blood stasis, there would be hair falling out in clumps, hypochondrial and or abdominal pain, painful periods, menstrual blood dark and clotted, masses in abdomen, purple nails and lips, purple or dark complexion, purple tongue, and wiry or firm pulse. As a rule of thumb, hair falls gradually if it is due to a deficiency of liver, blood, or kidneys, whereas if it falls out in clumps, it is due to a fullness, often internal wind. So let us look at the quality of the hair and what it could be as an indication of a disease. So let's look at quality. The quality could be color, the sheen, the thickness, and the hair loss. For color, with its original color, the indication could be a sufficient blood and kidney essence. If it's premature graying hair, there is deficiency of kidney essence. For the sheen, If it's shining, lustrous, and moist, the indication is sufficient blood and kidney essence. If it is withered, lusterless, or easily broken, there's deficiency of blood and kidney essence. For pediatric cases, dry and withered, sparse, hair sticks together in spikes, that's an indication of malnutrition syndrome. For the thickness of hair, if it's thick and lustrous, the indication is sufficient lung qi or kidney essence. If it's thin and sparse, it's insufficient kidney essence or kidney deficiency. For pediatric cases, for sparse, coarse, and light-colored hair, that's an indication of insufficiency of prenatal essence or constitutional deficiency. For hair loss, hair thinning or falling out is an indication of blood deficiency, or hair falling out in patches like alopecia areata is blood deficiency with wind attack. Thank you so much for your attention.